Great.
Fine. And welcome in, everybody. My name's Jim Deedlow here at WJOB AM 1230 and 104.7 FM. Sitting here in the studios along the boulevard. There's the boulevard. In the middle of a Monday. It's beautiful. It's hot out, so you got to worry about that. But I think it's time to talk stenosis and to talk about wellness in a pandemic. And there is no better person to do that than Dr. Sean Kondamuri. How you doing, doctor?
Doing fantastic, Jim. How about yourself?
It is a hot but sunny Monday, and I have spent the entire day talking about whether we should open schools or not. So that's a different, and have athletics, but we'll get to that in a minute. Doctor,
I'll just talk about that too.
yeah, remind people who you are and what you do.
Yeah, my name is Sean Kondamuri, and I am a physician. I'm a spine specialist. My practice is called Midwest Interventional Spine Specialist, and I have 4 other doctors with me and 2 nurse practitioners. And we are located in Munster, Indiana, Dyer, Hobart, and Chesterton.
All right, we forget about the doctors sometimes. So 4 doctors, who are they?
Yes, Dr. Satish Desari, Dr. Nikhil Shetty, Saveen Kondamuri, and Vijay Gupta.
All right, and then you have the NPs.
We have 2 NPs, Katie, sorry, 3 NPs, Katie, Lisa, and Rita.
Okay, and what do the NPs do?
Yeah, great question. So we have a lot of patients that we see. So on our very first couple of visits, they see the doctor, and then a plan is put into place, and that plan might be something that requires some injections or some procedures or minor surgeries or medication management or physical therapy. So we start the plan in place, and then the follow-up is usually with the nurse practitioner for the first or second visit after we see them. And if the patient's following along the treatment plan, then they are going to do well. But if they need to be sent back to us, meaning the physicians, then we'll see the patient again and get them on the right track.
What is the advantage to having the NPs in a practice?
Yeah, so the way healthcare is set up now, our reimbursements for any medical doctor, the reimbursements have been gradually coming down every single year. So for us to spend time with the patient, which they require, they deserve that time with somebody who can help them. It does not allow us to see all our patients if just the doctor sees them. For some routine care, for care that is fairly straightforward, a plan that when we train nurse practitioners in certain treatment plans and they know how to manage a particular problem, they don't necessarily have to see the doctor. So that's where the nurse practitioner works as an extender of the physician service, sort of like it's sort of a helper to help us see more patients and get patients to our system a lot quicker and get them well faster.
We're talking to Dr. Sean Kondamuri. If you got any questions for him, 219-845-1100. We started this out to talk about advancement in spine and pain and general wellness. And the last few installments have actually turned into talk about wellness in a pandemic and what you should do. So we'll come back to that a little bit in a few minutes, but we could talk about that in general. But right now, let's take maybe one or 2 specific spine or pain topics. Let's just throw one out, doctor. How about spinal stenosis? What is it, and what can we do about it?
Yeah, spinal stenosis is a very common condition, especially in our elderly population, some of our senior citizens, but it's also not uncommon in a 50-year-old or a 40-year-old. And what spinal stenosis is a narrowing of the spinal canal. So the spinal canal is, if it's typically this big and the spinal cord passes through that opening, if it becomes narrowed and becomes smaller, then the nerves are going to be a little bit more compressed, and having compression of those nerves and the spinal cord causes some symptoms such as pain in the legs or numbness or weakness in the legs, especially when you walk. So patients will tell us that they walk a little distance and they have really bad back pain and leg pain, and then they stop walking and sit down and the pain is gone. That's pretty indicative of spinal stenosis. Patients also will say that, well, when I bend forward a little bit, I feel better, because what they're doing is when they bend forward, they're opening up the spinal canal a little bit. And by doing that, that helps reduce pressure on those nerves. And they tend to do that just out of habit because it feels better. They tend to enjoy leaning on a shopping cart and driving around a grocery store because it feels better. Those are some pretty classic features of spinal stenosis.
All right, so does everybody with spinal stenosis present symptoms?
No. Some patients will be totally asymptomatic, and they can have some fairly significant changes on their MRI scan or X-ray, but yet they'll have no symptoms. But one day something might happen where you just kind of tweak your back and you twist it a certain way, then you create an inflammation in the spine, and those areas that were already somewhat narrowed now become a little more narrowed from the chronic inflammation, and now you have more severe pain.
So how do you treat it?
Yeah, so the first things we do are pretty conservative care, and that might include physical therapy and the use of anti-inflammatory medications. So physical therapy is done. Here's a model of a spine.
All right, so, remember, Doc, we're on radio too, so you got to describe it.
I'll describe too.
Yeah.
So I'm holding a spine, but what I'm showing you is a model of a spine that shows the openings where the nerves come out of, and those nerves come out of those openings. If those openings are narrowed, that puts pressure on the nerves. If the spine is very tight and stiff, then that's never going to really improve. So physical therapy will help to loosen up the spine, help to loosen the muscles up, and allow that spine some more range of motion and mobility. And if there's more range of motion, patients can do really well, especially if you give them an anti-inflammatory. But sadly, most of the patients who come to me have already had that done, and they're not better. So by the time they come to me, the family doctor has already sent them to the therapist, already given them some anti-inflammatories or muscle relaxants. They still have pain. So what we will sometimes do is we'll go into their spine with an injection, a small needle into the area where the narrowing is the most severe. And sometimes that injection of a steroid in that area can very easily remove the inflammation and give them less pressure on those nerves and significant relief of pain. That's the first step usually, certain specific injections in the spine to help take away that pain.
All right, so physical therapy, like what kind of physical therapy?
Yeah, so it's basically the therapy that most physical therapists can perform, which is a lumbar mobilization program or a McKenzie program. But basically what you're trying to do is you're trying to improve the range of motion, and you're trying to help the muscles relax. And there's a number of exercises that the therapist will give you, which you should continue at home. Those exercises that you do in front of them, you continue them at home. Pretty much lifelong, you continue these exercises, and you're going to do really well.
Do people follow your directions or the physical therapist's directions?
The people who want to get better and who get better follow my directions.
Let's leave it at that. Anti-inflammatories, best kind, best ones.
So there's a few different anti-inflammatories. If you can tolerate the ordinary anti-inflammatories, those are the things that are called NSAIDs. Those are fine. I have a number of medications I use. One is called nabumetone. I'll even use ibuprofen or naproxen. Those are common anti-inflammatories. But if somebody has a more delicate stomach, I might use something like Mobic. So for some of our seniors, I tend to use Mobic, which works by a slightly different pathway than the NSAIDs. And so that can be.
So there are other, because, first thing you say anti-inflammatories, first thing I think of is, I already have enough trouble. I'm drinking a Perrier right now to keep my stomach reasonable right now. You throw a few naproxen on that baby, and it seems to me, and I've done this played athletics all my life, always injuring stuff. Naproxen would seem to be the one sometimes that would churn my stomach, even though it seemed to work better than some of the others. So
we have to cycle you through that. So we'll ask our patient what they've been on and what's caused them problems, and we cycle them through the right medicines. There's a number of different kind of medications, and we kind of customize the care for the patient's conditions.
Hey guys, 219-845-1100. You got a question about anything with stenosis or your spine or anything like that? We have Dr. Sean Kondamuri with the Midwest Interventional Spine Specialist. All right, so let's go back to this. Numbness.
It's pretty exciting, spinal stenosis now, because it used to be that if my injections don't work, the patient's going to have surgery. That was the next step, to decompress the spine. And that still is the next step if you have very severe stenosis. But we have a couple of nice steps in between that we can offer patients that have been very, very exciting and can help patients a lot.
All right, so numbness in the legs. I don't know how many relatives I know that have had that or have that. Is the only thing that makes that happen spinal stenosis, or are there other possibilities?
There are many other possibilities, Jim, and it's never so simple. But spinal stenosis can cause numbness in the legs. A sciatica can cause numbness in the legs. A herniated disc can cause numbness in the legs. And one common thing that we don't think about a lot is peripheral neuropathy, commonly from diabetes. Diabetic neuropathy can cause numbness in the legs. And other neuropathies, like from vitamin deficiencies, can cause numbness in the legs. So we really have to talk to the patient, examine them, do some testing, and find out exactly where that numbness is coming from.
Sciatica, what's that?
Sciatica is when the spinal nerve that actually emerges from the spine, when that spinal nerve is pinched by a herniated disc. And if this is the disc right here, that disc, if it pinches that nerve, when it protrudes out and hits that nerve, then that nerve is going to be irritated and it'll cause pain down one leg. Spinal stenosis will do the same thing, in addition to the other symptoms that I said spinal stenosis causes.
All right.
Sciatica is typically pain down the leg.
Similar, but not exactly the same.
Yes. Oftentimes coexisting, though.
Oh, really?
Yeah,
so does the steroid, is that only good for stenosis, but it's also good for some of these other things too?
Oh, yeah. It's very good for sciatica also, especially, I mean, if it's a simple herniated disc, one level, and that happened within the last couple of months, patients can do extremely well with the steroid injection. We call that a transforaminal epidural injection, and they can do pretty well from that, along with some physical therapy.
How long do the steroids last?
I have many patients who literally, Jim, I'll treat them once or twice. I may not see them for a few years.
Okay, so but typically it's rather long lasting. It's not.
It can be
in the back. Yeah.
The point you have to make though is I tell my patients, yes, it's going to help you. It's going to reduce that inflammation. As long as the inflammation and stiffness doesn't come back, you'll do well. So what do you have to do? You've heard me say it many times, right, Jim? They've got to continue exercising.
All right, let's move on to that. This is the portion where we go on to that. It's top of the hour here on the radio, by the way. I got to give you a legal ID. You're listening to AM 1230 WJOB and 104.7 FM. Of course, you're also watching on Facebook, Amazon, Apple, Roku, the WJOB app, and all of those other places also. All right, we're talking to Dr. Sean Kondamuri, and he is with Midwest Interventional Spine Specialists, and we're talking first about stenosis, which is kind of interesting. I know a lot of people wind up getting steroid shots. I'm a golfer, and I know a lot of guys that have gotten those. All right, so we're in the pandemic now, all right? And we've been here a long time. You were giving people a lot of just like, I guess, wellness tips and mental health stuff, but here we are. We're in for the long haul now. We started talking about it in March. Here we are in August, mid-August now. So let's see, that's 5 months ago. So how is this evolving from a wellness standpoint?
Well, I still firmly believe that if you keep yourself healthy and fit and allow your immune system to do the job it's supposed to do, you're most likely to stay safe.
All right.
If you eat poorly, if you don't exercise, if you don't sleep, if you smoke, if you do all the things that we know are wrong and bad for your bodies, then that's only going to put you at a slightly higher risk to maybe catch COVID.
All right, so let's go back to some of these things, and we have to remind people because I've had people ask me about it, but you have a couple of code words or a couple of things that you like to live by, and these can be especially pertinent during a pandemic. Can we go back to some of the wellness?
Sure.
Yeah, so you talk about love, go through the...
Oh, okay, so I think what you're talking about is that little simple to remember phrase that I often use, and that's eat less, move more, stress less, and love more.
Eat less, move more, stress less, and love more. Now, Doctor, let's give this, let's put this into context here. This is longer than I would have ever thought we were going to be talking about this, okay?
I'm all yours, Jim, whatever time you need for me.
Yeah, so how long is this going to last?
Oh, COVID-19?
Yeah.
Oh, for certain until 2021. I mean, it's going to go through the winter. So and then at that point, maybe things will improve because we might get a vaccine next year. I don't think we're going to get one this year. And then if enough people vaccinate, say 70% or 60% of the country vaccinates, we'll probably have a good handle on this. But it's very possible that we're going to have remnants of this going on through 2021 for sure.
All right, so there's we're in a weird spot financially, we're in a weird spot politically, but we're also in a weird spot health-wise. And here's one that, we're big sports folks here. That's what I started out in here. And we watch a lot of baseball. And there's a number of pitchers right now that are hurting their backs. They didn't have as much time as they would over the winter in February, March, at spring training. They work up from 1 inning to 2 innings to 3 innings. They kind of had to skip some tests or skip some steps. And there's a number of guys hurting their backs. What's happening to their backs?
Classic, right, Jim? I mean, you pretty much described it without saying the words. Where they went through COVID, it hasn't been the routine of fitness and training and muscle development, cardio, yoga, all the stuff that these elite athletes are typically going to be doing. They're not doing. They're just not keeping up because it's hard to be motivated. And if you cannot keep your fitness at that high level, then you can't perform as an elite athlete. I mean, it even our high school and college athletes, it's the same thing. They really have to. Fitness is the number one thing. My son is a tennis player, and his game improved a lot when his fitness improved. Your fitness is so important because no matter what, whenever a pitcher plays or a tennis player plays his match or a football player plays, they always play with a little bit of pain, a little bit of aches and pains here and there. But if you haven't worked those muscles or stretched out those joints and done some toning, it's going to set you back. You won't be able to perform. And you have to perform with a little bit of discomfort.
All right, well, the question I'm getting in from one of my buddies is, all right, so we're seeing most of the injuries right now in baseball. Hockey isn't getting like strains and back pulls and that kind of stuff as much. But we are going to be going into football, all right? And so they're not going to have had as much time as they normally would, and not as much time with their trainers, not as much time on the field and stuff. What are the dangers for football players?
I mean, they're at high risk. I mean, especially if they're not in tip-top condition, they're going to be at risk of injuries. And football is such a contact sport, they're looking at injuries of any part of their body.
So, I mean, well, let's specifically drill down to their spines and their backs and that kind of stuff. I mean, one of the, who was the big pitcher, the Cy Young Award winner, all they're saying is he strained his back. Okay, I don't know what that means. I mean, is he developing a sciatica or stenosis, or is there a muscle strain, or what are the kind of things that'll get?
Yeah, usually if the news report says sprain their back, I mean, those athletes are automatically going to get an MRI scan of their back, always. I mean, the team doctor will get an MRI scan, so that means there's probably not a herniated disc, there's probably not a pinched nerve. And then what are you left with? You're left with muscular conditions, and that's a sprained back. And the sprain is a muscle. Or multiple muscles that are not loosening up. Most of the back pain that we see is muscular.
All right, so bring that spine up again, will you? And show us where you're talking about the muscles, because all I see are tendons and nerves and bone.
So all you're seeing in this model is just the bone. This is just the spine. So these are the vertebrae. These are the discs, vertebrae, disc. And then the nerves come out of the spinal canal on both sides. The muscles are in the back of the spine. So back here, we have muscle. We have a column of muscles on either side of the spine, which are sort of symmetric. There's a whole bunch of muscles back there, and they have an obvious function to perform. If those muscles aren't equally balanced and relaxed like they should be, and toned the way they should be, you're going to start having some problems. If the side is significantly tighter, that sets off a whole chain reaction of problems in different parts of your body, because you now have pressures applied to different parts of the body, different parts of the spine in particular, that are going to cause you some pain. So that just goes back to whether it's an athlete or a 60-year-old gentleman who wants to play golf, it all goes back to fitness. You need to at least walk if you're the golfer who's 60 years old, but you need to do some weight training, you need to do some yoga and stretching and other things that the athletes will be doing.
We're talking to Dr. Sean Kondamuri. You got a question about any of your fitness or any of your any athletics, or of course anything about the spine? Now, doctor, you brought up golfers. We are seeing record numbers of golfing right now because it's outdoors. I mean, it's kind of lower risk for COVID unless you're like all over each other in a foursome. But typically, it'll be one person you ride with. If they're a family member, then you really can almost do no exposure. But I've seen a number of guys out there that don't play that often. I'm going out tomorrow to play in the league. There's a number of guys that might play 4 or 5 times a year. Almost to a T, they're saying their back hurts. Anything they can do?
Start exercising. Start working on your diet. and your back problems will be much better. Because I see that patient every single day, Jim. A majority of my older men, their primary goal is, Doc, I don't care. I don't need to do anything. Just get me back on the golf course.
Oh, in a heartbeat. I got to believe you hear that all the time.
Yeah, well, I hear it all the time.
And sometimes they want the shortcut of the shot, don't they?
Yeah, I mean, they do, and that sometimes helps get them over the hump, but that's kind of temporary. You have to now start instituting a real program. And many of them do. They realize that they've got to do that.
Well, I'll tell you what I found, and I told you that I do yoga ever since I got in a car wreck, and I kind of have to maintain, but from a golfing standpoint, if I do yoga in the morning and I play like 2 or 3 hours later, it really, my back's okay, but I feel like all my muscles are firing almost like a weightlifter, and it really cuts down on my proficiency in my game. At least that's the excuse I'm using these days for playing so poorly. But,
do you weight train, Jim?
Well, I don't, but I consider, if you're doing yoga right, you're doing all the pushing off and stuff, you get a little stronger. And I do a little bit of weight training. So next thing you know, I'm not overly bulky, but I know that my muscles are tighter than I would like them to be to play golf. And, it's like, all right, you got to keep your back loose, so you got to do yoga. But when you do yoga, you wind up building up your arms and your chest, even though you don't really want to. And then, of course, I do a little bit of lifting just for, for aesthetic purposes. How's that? So next thing you know, you're like, I'm stronger than I want to be to play golf, if that makes sense. You look at these golfers, and I watched the PGA Championship yesterday. The golfers, oh, wow, they look in really good shape, and all the flat bellies are flat bellies, but they're not overly done in their arms and their chests. There's a couple of them, like.
But yesterday, though, Jim, they're all young.
Yeah, they were all young, all of them.
Years old. They're all under 25, 26. Those guys are in top condition, right?
You watched it?
Guys, I did, yeah. It was amazing. That kid, that 23-year-old Colin Morikawa, I mean, he's going to be a phenomenal kid. He's going to be a phenomenal player.
Did you notice the same thing? It's almost as if you're over like 35, you almost can't handle 4 rounds of that kind of pressure in 4 days. And I think, if you ask me what's happened, is that when they had the crowds, that would kind of carry a guy along with momentum and adrenaline, especially an older guy that everybody liked, right? Absolutely. A Phil Mickelson or a Tiger Woods, that kind of thing. And then all of a sudden you get all these young guys that are just strong, but they're so strong in their core. Like it's from knee to chest. I mean, even Morikawa, he wasn't that strong, but then, then you see him like walking, and then you're like, dude, he could be a fullback. There's a lot of dudes now that, back in the day, there were skinny guys that would just turn all the way around. And now they've got this like incredible power right around their stomach.
Well, that's how they're able to drive that ball when they're teeing off. I mean, it is core. And if you look at them, I mean, many years ago, right? I remember how you just said a lot of guys really didn't look like they're in shape, but Tiger Woods changed that, right? He started working out. He started getting in great, physical shape. He had great muscular development, and then it started passing through to the whole tour, and everybody started working out. And now you see more people who look like they're in fairly good shape than not.
Exactly. So by the way, we're talking to Dr. Sean Kondamuri. Somebody asked on Facebook who it is. Doctor is with Midwest Interventional Spine Specialist, but he also obviously is a sports fan and can talk a lot about wellness. The interesting. All right, go ahead, talk about that.
If you've got to walk 18 holes for 3 days in a row or 4 days in a row, that is serious. I mean, you're a golfer, so you probably, I don't know if you walk or if you ride your cart, but it's enough. It's physically draining just to drive your cart and walk, 10, 20 yards sometimes to the ball. Those guys are walking 8,000 feet, right, every time they play, and you've got to be in good shape for that.
Yeah, and you got to have good joints. I mean, a lot of it's on softer ground, of course, but they do walk cart paths and that kind of stuff. And I do have to give a plug here. I did watch Colin Morikawa win, and my wife's like, "Well, you never even seen this guy. How can you be pulling for him?" Well, he went to my alma mater, and
okay.
you saw all the Cal golfers out there. They were exciting. When I was there, I was on the boxing team. And
Really?
we actually shared some of the facilities with the golf team, and believe me, they weren't nearly as good as these guys, because there was another guy that is supposed to be actually better than Colin Murakawa, who's there now. And
Wow.
so they may, who knows, they may have a major champ within another 4 or 5 years. But it was
Right.
pretty big day in the Bay Area. And I had a couple texts from guys like, oh my God, you see that? A Cal guy is going to win this thing. And he just graduated.
I know, he just graduated.
I know, it's
And
just
he actually got a business degree in 4 years.
Yes.
While playing golf. That's unbelievable.
And I got to tell you, I went there for a week-long venture capital thing. And when I was there, I didn't study any business. It was all like numbers and logic and theoretician stuff. But I went up and I stayed near the business school and then went every day for 8 hours to the graduate business school. That was the most grueling. You go to conferences, you go to webinars, you go to all this stuff. They work the hell out of you, and the professor was like, "Man, this is nothing. You should see how we work these young kids." So if he's going through there in 4 years, he knows his stuff.
He knows his stuff for sure.
Hey, doctor, I know you got some more patients in the waiting room. Thanks for joining us. Like always, share this around, everybody. It's health and wellness and spinal care and all that stuff. Anything else there, doctor? Final comment.
All right, we're good, Jim. We covered a lot today.
We did. Thanks a lot. Talk to you soon.
Thank you, Jim. Have a good one.
All right, there it is, guys. All right, that's Dr. Sean Kondamuri, and I'll be right back.